The lipid layer being produced by the meibomian glands. These glands are situated along the lid margins. The openings of these can be seen along the lid margin. Meibomian gland secretion, for easy understanding, I would like to compare with the vegetable oil that is present at the room temperature. So the meibomian gland secretion is also similar in consistency at our body temperature. Whenever there is some abnormality in the meibomian gland, the consistency becomes little hard and it becomes something like ghee, which is semi-solid at the room temperature. And if there is furthermore abnormality, it can be something like dalda at room temperature. So the meibomian gland secretions, they become harder at our normal body temperature and they do not form a clear layer on the surface of the tear film. So this causes the underlying aqueous layer to get evaporated very fast. What are the causes for dry eyes? There are multiple reasons, the factors that can precipitate dry eyes. It can be because of the excessive exposure to the light. It can be because of the hormonal changes that is happening in the body. It can be because of certain drugs that we are taking. The lifestyle of people, such as excessive smoking, can also lead to dry eyes. Definitely there are multiple factors which are associated with the development of dry eyes. Usage of contact lens, spending more time in dry humid areas can also lead to dry eyes. What are the symptoms that you face when you have dry eyes? You can feel some kind of stinging sensation, some foreign body sensation, grittiness in the eyes. You feel like itching. You can feel transient blurring of vision, excessive watering in the eye, or some kind of strain that is there whenever you use the screen time. So these are different presentations of dry eye, and not that all the patients have similar symptoms. There can be difficulty in focusing near objects. There can be increased sensitivity to the light because of the dryness. Now, how to handle the dry eye? Digital eye strain or the computer vision syndrome also has got certain other features associated with dry eyes. So the patient suffers from dry eyes, headache, blurring of the vision along with dry eyes. So how to handle dry eye and how to decrease the eye strain? We need to identify the cause for the dry eye. Hot fermentation is one of the best options, provided lipid layer abnormality is present in the patient. Hot fermentation, which is harmless and can be done at home with convenience, is the first thing that you can try at home. Quality of the lipid layer is always important to you. It is always important for you to include omega-3 or omega-6 rich food in your regular diet. So hot fermentation becomes the first step. The second step is following the 20-20-20 rule. That is, for every 20 minutes, you need to take a break for 20 seconds and look at something which is 20 feet away. Relax, pause your work, squeeze your eyes and then open. This helps the muscles of the eye to relax a little bit. Try to blink frequently. This blinking frequently will prevent the evaporation of water from the eye. This is the third thing that you can do. And using of lubricating eye drops. Lubricating eye drops can be used when your screen time is more than 4 to 6 hours in a day. You take some kind of lubricating drops only under the supervision of the ophthalmologist. But in case you are not having any access to an ophthalmologist given the situation of COVID, you can definitely use lubricating drops. They are going to help you out. The other thing that you also need to focus on is your posture. The posture that you are, the way you are sitting, the distance of the screen from your eyes, as well as the exposure of the light. That is, whether you are working in very bright light or you are working in less than normal brightness. This also matters a lot and causes dry eyes. The one important thing that I wanted to share with all of you is something about the light affects our natural circadian rhythm, that is the sleep and wake cycle. This blue light, which we see just before sleep through the cell phones, are definitely going to affect the sleep pattern. So 1 to 2 hours just before sleep, it is better to avoid your cell phones or use minimal light. Use night mode on your electronic devices. In case you are wearing contact lenses, there are more chances that you suffer from dry eyes, and whenever you feel any kind of dry eyes or irritation or itching or redness, you avoid the contact lens and immediately meet your ophthalmologist. So there is one more concept that has recently come up, that is mask associated dry eye. So mask associated dry eye, what happens is the air that you exhale, it comes up and it causes dryness in the eye by causing evaporation of the tear film. So make sure that the mask that you're wearing is properly fitting along the nose, or you can use some paper plaster to make it fix onto the nose so that the air doesn't come out. Those who have got diabetic retinopathy, macular diseases, should definitely visit their ophthalmologist and get their vision checked or get their eye checkup done properly. If you notice any kind of blurring in the vision, you see some wavy blank spots in your field of vision, you should definitely come to an ophthalmologist. If you have any kind of eye injury, even if it is minor, you should come to an ophthalmologist. And if you notice any kind of flashes or floaters, you need to attend to your ophthalmologist. Some loss of vision which is sudden also is an important condition where you are going to look at your ophthalmologist. And any red eye, itchiness, discharge in the eye, that is again a compulsory situation where you will be seeing your ophthalmologist in the COVID period. So today key points, or the video's key points regarding dry eye and digital eye strain is: follow the 20-20-20 rule, blink frequently, wear correct spectacles, that is the proper spectacle correction, use lubricating drops under supervision, eat food that is rich in omega-3 and omega-6 fatty acids, avoid screens especially in kids between 2 to 5 years of age, get examined regularly with an ophthalmologist if you have the above mentioned or the prior mentioned conditions. Thank you, and we'll see you again in a next video.